In order to bring down the cost of drugs for patients, what needs to happen is gag clauses need to be removed from contracts between pharmacists and the pharmacy benefit manager. A gag clause basically makes it impossible for a pharmacist to proactively discuss pricing and costs with a patient on their medication. With that removal, they can have a more open and honest conversation about what is in the best interest of that patient.
As a local pharmacist, we try to protect our patients from clawbacks because we have our patients' best interest at heart and don't want to see them overpaying for medications that they could obtain less expensive.
What is a clawback?
A clawback is something that's instituted by a pharmacy benefit manager or PBM, which is usually unseen by the patient. So, for example, the pharmacy bills for a prescription, which is typically a generic, and just for easy numbers' sake, let's say the pharmacy bills $100 to the pharmacy benefit manager. The pharmacy benefit manager may then pay the pharmacy $25, but charge the patient $100, and the pharmacy benefit manager keeps the $75 for themselves. So the patient ends up overpaying because the pharmacy's regular cost of that medication is somewhere around $25. So if the patient were to ask if the cash price is less expensive for the medication, the answer would be yes. But because our contracts prevent us from telling the patients what our actual price is when they have insurance, the patient is often unaware that they're overpaying for the prescription medication.
What needs to happen?
The gag clause needs to be lifted from our contracts and allow us to tell patients when they are being overcharged by their insurance company and give them the option to pay cash if in fact the cash price is less expensive than what their copay is.
Is this something that the legislature needs to address?
Absolutely. Absolutely. The clawback and the gag order needs to be addressed to help local community pharmacists continue to care for their patients.
Running a local pharmacy is a business. How does that impact your business when this happens?
It impacts my business because I truly put my patients' care, health, and well-being of that cost as a factor first. As a business owner, obviously we're in business to make money, but I don't feel good about overcharging patients when I know for a fact that they're being overcharged. It also puts me in the middle of a contracting issue where 3 of the largest pharmacy benefit administrators dictate 80% of the claims that are being processed. So in the event that we were found to be in violation of those contracts, we jeopardize being kicked out of those contracts, which would be a huge detriment to our business. So the pharmacist really can't disclose to the patient that they are being overcharged. It's up to the patient to ask, is this the best price that I could be receiving for this medication? That allows us to explain to the patient that they are being overcharged.